today, and thank you everybody here. Yes, we have achieved a milestone, but the credit goes to the entire team. It is not one person's job to treat any patient, maybe breast cancer or any other kind of cancer. For sure, the entire team is here who has been a part of this journey of ours, and I'm very happy to share what is it that we have achieved. So to begin with, we know that the incidence of breast cancer in India is on a rise. It is estimated that 1 in 29 women in India has a lifetime risk of developing this disease. And what is most disturbing in India is that about 48% of women who develop breast cancer are young and they are less than 50 years of age. About 4% of them are just 20 to 30 years. About 6% of them are in the age group of 30 to 40 years, and 28% of them are in the age group of 40 to 50 years. So you can imagine the trauma that a woman goes through when she is diagnosed with breast cancer and when she is very young. And the issues that we have to deal with, along with being scientific, are many, many more. And the body image is one of the major things.
Being a medical oncologist, there's so much which is changing in oncology, and we have to be abreast with all this latest stuff which is happening in the world. And we have so many other things like nanobots and nanoparticles of drug delivery, where there's precision oncology, delivering the right drug to the right patient with least possible side effects. That is what we're doing in 2024. Not only that, Dr. Govindarajan's domain. So now we have something called where robotics is helping us to navigate and get image guided biopsies with precision, that amount of accuracy, using PET CT and using robotics to help us navigate and get the best possible diagnosis.
We are a 27-year-old company. So far, we've launched 5 generations of Da Vinci in the world. In India, we've launched Da Vinci 4, on which this procedure was performed. So far, till date, more than 14 million procedures have been performed on Da Vinci Da Vinci systems. Every 14 seconds, a Da Vinci procedure starts globally, which means through the course of my presentation, more than 40 procedures would have started across the globe somewhere. So far, this technology is very well researched. More than 38,000 peer-reviewed publications are credited on Da Vinci technology.
The milestone is that we have managed to get the first patient who has benefited from this technology from the state of Karnataka, which also puts us on the global map. When we started this journey about early this year in 2024, we were trying to understand what are the challenges that clinicians and patients go through. One of them we realized is to take the step forward in the battle against cancer. If you look at the 3 clinical presentations made by Dr. Jayanti, you'll find one of them is 28 years old, the other one is 40 and the other one is 50. What it shows is that cancer is a great equalizer. It doesn't actually look at anybody from a caste, creed, religion, age, or social economic bearing. It could touch everyone. Two of them were fortunate to be screened early through the new innovative technology and program we have started, which is called the fastest and most precise breast cancer screening program, which makes sure that the patient gets the answers for all the questions that she has when it comes to her own breast health by the end of the day in 24 hours. What it brings about is the importance of awareness and screening, which is the first step. Very less is done in India. The battle against cancer is half won by taking the step forward, by actually getting people to come in for awareness and screening. While technology is a great enabler, to me, if everybody could take that step forward and actually understand their cancer quotient for coming forward to actually get screened, get diagnosed, and also understand how easier it could be, because as the adage goes, earlier you say you can nip it in the bud.
I'm Dr. Jayanti Thumsi. I work as a lead surgeon in the Department of Breast Oncology at Apollo Hospital, Bannerghatta Road. ಇವತ್ತು ನಾವಿದೊಂದು ಮೀಟಿಂಗ್ ಮಾಡಿರೋದು ಒಂದು ಹೊಸ ಟೆಕ್ನಿಕ್
ಫಾರ್ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ ಸರ್ಜರಿ. ಅದಕ್ಕೆ ರೋಬೋಟಿಕ್ ಅಸಿಸ್ಟೆಡ್ ನಿಪ್ಪಲ್ ಸ್ಪೇರಿಂಗ್ ಮ್ಯಾಸ್ಟೆಕ್ಟಮಿ ಅಂತ ಹೇಳ್ತೀವಿ. ಇದರಲ್ಲಿ ಏನು ವಿಶೇಷತೆ ಅಂದರೆ ಇಂಡಿಯಾನಲ್ಲಿ ನಮಗೆಲ್ರಿಗೂ ಗೊತ್ತಿರೋ ಹಾಗೆ ಇನ್ಸಿಡೆನ್ಸ್ ಆಫ್ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ ಜಾಸ್ತಿ ಆಗ್ತಾಯಿದೆ. ಆಮೇಲೆ ತುಂಬ ಯಂಗ್ ಆಗಿರೋ ಮಹಿಳೆಯರಿಗೆ ಇದರಿಂದ ಎಫೆಕ್ಟ್ ಆಗ್ತಾಯಿದೆ. ಅದೇ ಟೈಮಲ್ಲಿ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಕೂಡ ತುಂಬ ಅಡ್ವಾನ್ಸ್ಡ್ ಆಗಿರೋದ್ರಿಂದ ತುಂಬ ಪೇಷಂಟ್ಸ್ ಕ್ಯಾನ್ಸರ್ ಬಂದರೆ ಕೂಡ ಸರ್ವೈವ್ ಆಗ್ತಾ ಇದ್ದಾರೆ. ಸೊ ಸರ್ವೈವ್ ಆದಮೇಲೆ ಅವ್ರಿಗೆ ಒಂದು ಗುಡ್ ಕ್ವಾಲಿಟಿ ಆಫ್ ಲೈಫ್ ಕೊಡೋದು ಕೂಡ ಅಷ್ಟೇ ಇಂಪಾರ್ಟೆಂಟ್. ಬರೀ ಕ್ಯಾನ್ಸರ್ ಕ್ಲಿಯರೆನ್ಸ್ ಅಲ್ಲ, ಗಿವಿಂಗ್ ಅ ಗುಡ್ ಕ್ವಾಲಿಟಿ ಆಫ್ ಲೈಫ್ ಕೂಡ ತುಂಬ ಫೋಕಸ್ ಇರಲೇಬೇಕು. ಅದನ್ನು ಮನಸ್ಸಲ್ಲಿ ಇಟ್ಕೊಂಡು ಅದನ್ನು ವಿತ್ ದ್ಯಾಟ್ ಇನ್ ದ ಥಾಟ್ ವಿ ಹ್ಯಾವ್ ಡನ್ ಅ ನ್ಯೂ ಪ್ರೊಸೀಜರ್ ವಿಚ್ ಇಸ್ ಕಾಲ್ಡ್ ಆಸ್ ರೋಬೋಟಿಕ್ ಅಸಿಸ್ಟೆಡ್ ನಿಪ್ಪಲ್ ಸ್ಪೇರಿಂಗ್ ಮ್ಯಾಸ್ಟೆಕ್ಟಮಿ. ಅಂದರೆ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರಲ್ಲಿ ಕೆಲವು ಸತಿ ಪೂರ್ತಿ ಬ್ರೆಸ್ಟ್ ತೆಗೆಯೋದು ನೆಸೆಸಿಟಿ ಆಗುತ್ತೆ. ನಾವು ಇದನ್ನು ರೋಬೋಟಿಕ್ ಅಸಿಸ್ಟೆಡ್ ಮಾಡಿ ಒಂದು ಸಣ್ಣ ಇನ್ಸಿಷನ್ ಅಂದರೆ ಕಟ್ ಮಾಡ್ತೀವಿ, ಸ್ಕಿನ್ನಲ್ಲಿ ತುಂಬ ಸಣ್ಣದಿರುತ್ತೆ, ಕಂಕಳ ಕೆಳಗಡೆ ಸಣ್ಣ ಕಟ್ ಮಾಡಿ ಅದರ ಥ್ರೂ ನಾವು ರೋಬೋಟಿಕ್ ಮೆಷಿನ್ ಯೂಸ್ ಮಾಡಿ ಬ್ರೆಸ್ಟ್ ತೆಗೆದಿದ್ದೀವಿ. ಅದರಲ್ಲಿ ಸ್ಕಿನ್, ನಿಪ್ಪಲ್, ಆಮೇಲೆ ಏರಿಯೋಲಾ ಯಾವ್ದು ಹೆಲ್ದಿ ಆಗಿದೆಯೋ ಪೇಷಂಟಿದು ಅದನ್ನು ಇಂಟ್ಯಾಕ್ಟಾಗಿ ಇಟ್ಟುಬಿಟ್ಟು ಒಳಗಡೆ ಬ್ರೆಸ್ಟ್ ಮಾತ್ರ ತೆಗೆದುಬಿಟ್ಟು ಅದರಲ್ಲಿ ನಾವು ಇಂಪ್ಲಾಂಟ್ ಹಾಕಿ ರಿಕನ್ಸ್ಟ್ರಕ್ಷನ್ ಮಾಡಿದ್ದೀವಿ. ಈ ಸ್ಪೆಷಲ್ ಸರ್ಜರಿ, ಅಡ್ವಾನ್ಸ್ ಸರ್ಜರಿದು ಬೆನಿಫಿಟ್ ಏನಂದರೆ, ಒಂದಂದರೆ ಸ್ಕಾರ್ ತುಂಬ ಸಣ್ಣದಿರುತ್ತೆ, ಕಟ್ ತುಂಬ ಚಿಕ್ಕದು ಇರೋದ್ರಿಂದ ರಿಕವರಿ ಫಾಸ್ಟ್ ಆಗ್ತಾರೆ ಪೇಷಂಟ್. ವಿದಿನ್ 24 hours ನಾವು ಡಿಸ್ಚಾರ್ಜ್ ಮಾಡ್ಬೋದು. ಬ್ಲಡ್ ಲಾಸ್ ಆಗಲಿ, ಬ್ಲಡ್ ಟ್ರಾನ್ಸ್ಫ್ಯೂಷನ್ ಆಗಲಿ ಇರೋದಿಲ್ಲ, ಪೇಯ್ನ್ ಕಡಿಮೆ ಇರುತ್ತೆ. ಅವ್ರು ಕೂಡಲೇ ಅವ್ರ ಕೆಲಸಕ್ಕೆ ಜಾಯ್ನ್ ಆಗ್ಬೋದು. ಇವತ್ತು ಒಂದು ಪೇಷಂಟ್ ಅವ್ರ ಟೆಸ್ಟಿಮೋನಿ ಕೊಟ್ಟರು, ವಿದಿನ್ ಫ್ಯೂ ಡೇಸ್ ಅವರು ಕೆಲಸಕ್ಕೆ ಜಾಯ್ನ್ ಆಗ್ಬೋದು. ಆ್ಯಂಡ್ ಓವರ್ ಆಲ್ ಕಾಸ್ಮೆಟಿಕಲಿ ನೀವು ನೋಡಿದ್ರೆ ಪೇಷಂಟಿಗೆ ತುಂಬ ಸ್ಯಾಟಿಸ್ಫೈಯಿಂಗ್ ಇರುತ್ತೆ. ಥ್ಯಾಂಕ್ ಯು.